Good afternoon, and welcome to this installment of PolicyMap's Mapchats webinar series. My name is Brian Blacker. I'm one of the data analysts here at PolicyMap, and I'll be serving as the moderator for this Mapchat. For those of you who are joining a Mapchat webinar for the first time today, PolicyMap, the organization behind this webinar series, is a national online mapping service that provides maps and data visualization tools for tens of thousands of indicators related to housing, health, demographics, and more. Mapchats is a webinar series that we offer that features experts from a variety of topics, including housing policy, healthy food access, placemaking, and others. Our speakers discuss how their work incorporates data and mapping. The topic for this afternoon's Mapchat is PolicyMap in the Classroom, a tool for public health and sociology courses. And therefore, we're going to be taking a more PolicyMap-centric approach within the context of how university educators are employing the use of PolicyMap in their courses. Today, PolicyMap is being used in over 90 universities across the country to produce research insights, to serve as a supplemental resource for students, and to facilitate learning in the classroom. We commonly hear from our college and university subscribers an interest in hearing how professors at other universities are incorporating PolicyMap into their courses and research. We hosted a similar Mapchat on this topic a couple years ago, and it was very well received, so by popular demand, we are returning to the classroom this afternoon. Today, two professors have generously volunteered to share their experiences using PolicyMap in their courses. So first we will hear from Dr. Victor Perez, Assistant Professor of Sociology at the University of Delaware. Then we will have a presentation by Dr. Ann Hewitt, Master's in Healthcare Administration Program Director and Associate Professor at Seton Hall University. Before we dive into the presentations, I just wanted to cover a little bit of housekeeping. This is a webinar format, so all participants on the webinar are currently muted. If you do have any questions during the presentations, please feel free to use the GoToWebinar control panel. You can type your question into the control panel and we will either respond to you directly or we'll read your question during the question and answer session at the end. So after the presentations are complete, we'll aim to leave about 20 minutes to answer questions that are submitted by attendees. This Mapchat webinar will be recorded. The video and slides presented will be sent out by email, and they'll also be made available on our PolicyMap Mapchats webpage. If you happen to be live tweeting right now, you can also use the hashtag Mapchats to join in on the conversation on Twitter. So we're going to go ahead and get started with the presentations. Our first presenter is Dr. Victor Perez. As an assistant professor of sociology, Dr. Perez specializes in topics such as environmental justice, health and illness, and the sociology of risk. A unifying theme throughout his career has been the configuration of health, risk, and society, focusing on environmental and health issues through a social constructionist lens. His current research projects include a mixed methods approach examining perceptions of historic contaminants and sea level rise in an impoverished area of South Wilmington, Delaware. Dr. Perez regularly teaches a course on quantitative sociological research methods, social statistics, and data analysis. He has also created several of his own courses, including Environment and Health and Introduction to Mapping Social Issues. Dr. Perez holds degrees in sociology from Towson University and the University of Delaware. And now I will turn it over to Dr. Perez.
Well, thank you very much, and I wanted to thank everyone at PolicyMap for the opportunity to share some of the work that I've been doing in the classroom, and as well as all the other folks involved today sharing their time to be here. So, the title of my topic is Examining Environmental Injustice in PolicyMap, a tool for sociology courses. This is actually a deceptively simple way to introduce the idea of how social processes happen in place, literally in space. For example, sociologists know very well that knowledge of your zip code is one of the best predictors of a variety of your life chances, including health outcomes, education, family, and so forth. So this is a simple way, really, to introduce some of the core components of my research into my classes. studying things such as environmental injustice, and to really catalyze broader discussions and analytical techniques utilizing some of the software that's been made available to us here at the university through PolicyMap. So to begin, I wanted to start by defining environmental justice. It's a principle. It's really the idea or principle of fair treatment and involvement. And from Robert Rule and Pello, they talk about it as no population being forced to bear a disproportionate share of the negative human health or environmental impacts of pollution or environmental consequences resulting from industrial, municipal, or commercial operations. Environmental justice is a principle. However, environmental injustice is the reality. Environmental injustice is also known as environmental inequality in sociology and other disciplines. But specifically, this is the reality or what happens due to a variety of policies and social processes in places, in geography, in geospatial areas, where a specific social group is disproportionately affected by environmental hazards. And I italicize social there to really emphasize that the social characteristics of groups that determine these outcomes, for example, being disproportionately impacted by environmental hazards through proximity, breathing in poor air quality, having contaminated groundwater, or contaminated soils. The social factors of these demographic groups, for example, are the most important in determining exposure disproportionately. In my classes, I also take this one step further and I talk about environmental racism, a specific form of environmental inequality whereby we use the lens of race to try and understand disproportionate exposure to environmental hazards. So also from Brohl and Pello, they talk about this as the differential impact of economic or environmental policy, practice, or directive, intended or unintended, and it's really important, in communities based on race. So I'll often introduce the concept of environmental racism as one particular type of lens that allows us to understand the outcomes that we see, for example, in PolicyMap, the disproportionate exposure of certain social groups to environmental hazards. So let's use this lens very quickly in the context of PolicyMap. As I mentioned before, this is a very simple way to do this, to introduce this idea. And you can catalyze a variety of ways to examine it in PolicyMap. And students love the opportunity to be creative and looking for a variety of things that they can find that help to illuminate in even more depth these different processes. So environmental racism can be broken down largely into two forms. We can think about it as a community that might be made up of poor and racial and ethnic minority persons, and that community is targeted for the development of new industry. Or we can think about industry and how new communities might be built adjacent to that industry. And this community is generally serving poor or public housing. So that's one form of environmental racism, where we might look at active exposure to ongoing industrial pollution, for example. If you look near an oil refinery or a plastics refinery, something like that. However, this is a special kind of case of environmental racism that I'm trying to explore in South Wilmington, Delaware, which really is the result of a confluence of historical processes of economics and deindustrialization. And so if we're interested, one of the ways that we can examine how history and deindustrialization and race and economics interact is to look at where industry used to be, what it left behind, and what social groups are still there. We can look at that using the idea of a brownfield. A brownfield is an abandoned, idled, or underutilized industrial and commercial facility where expansion or redevelopment is complicated by real or perceived environmental contamination. So in other words, it's leftover contaminated soil. This can potentially have impacts on human health. For example, if there's something like arsenic or chromium or lead, we've seen many of these stories in the soil. They can impact children in particular and have a variety of health outcomes. Research shows that racial and ethnic communities generally have poor health outcomes, and this is at least partly explained by the disproportionate exposure to environmental hazards. So brownfields are something that we can find in PolicyMap. And I argue that this is a special case of environmental racism. So Lee and Mohai call this really a special case of environmental racism because they say brownfield sites, unlike hazardous waste and polluting facilities, doesn't involve decisions about new facilities, but rather about abandoning existing ones. And so it's really an interesting idea that focuses on various processes that account for where brownfields are concentrated as leftovers of industry, and the social groups that are left there as a result of essentially not being able to leave through a lack of resources. So in PolicyMap, there are a few explicit environmental indicators, but the brownfields indicator is one of them, sourced from the EPA. And just as to a piece of information here is the brownfields that are found in the PolicyMap database are EPA recognized. So brownfields designated by states or local entities, for example, might not be included in the PolicyMap data. So this is one place where we can begin to think about how to enhance more deeply the data that's available regarding brownfields. So there's some limitations. But what we can do with what we have is to combine this one particular indicator of race in a community at the local level, where students can employ the concept of environmental racism. And so at this point, I'd like to try and do that on the fly. And what I'm going to do is I'm just going to produce a couple of maps here very quickly to show you how easily you can utilize a sociological concept to drive an analysis in PolicyMap. So this is Wilmington, Delaware. This is the Christina River. Over here is the Delaware River and the Atlantic Ocean to its east. This is the area where I do most of my research. It's a community called Southbridge. It's a community that's generally poor and concentrated African American. So from the quality of life indicators, you can select brownfields. And then PolicyMap will auto-populate those brownfields. Now remember, these brownfield sites are in a variety of conditions. They've been identified, they've been addressed, they need to be addressed, they're being assessed for what's there. So for example, this brownfield site here is the A Street brownfield corridor. You can have information about where it is, but you can also get information about how big the site is, and you can also get information about what's there. EPA funds, for example, have been granted. The cleanup is still required. Assessment was completed. I'm not exactly sure what year that should be, but assessment has been completed. And so they found contaminants, metal contaminants, the soil's been affected, and the groundwater's been affected. So there's a variety of ways that this potential brownfield adjacent to a residential area could be impacting the community. Now, one way to apply environmental racism is once we've selected brownfields, is to simply select demographics. And then from demographics, select race and non-white. And at this point, I'll come back to the block group level by which this is shaded, but I want to show you at the census tract level a couple of things. First of all, we see brownfields concentrated in areas at the census tract level which have 45.40% or more non-white persons. So right away you can start to see how deindustrialization, South Wilmington, for example, is an area that had a variety of industries in the past and has very few relative to the past at this point, and has concentrated racial and ethnic minorities as well as the remnants of that industry. You can see that brownfields tend to be concentrated in areas that have significant numbers of non-white persons. Right away, this starts a discussion in the classroom. You can also utilize three-layer maps. And in the same exact area, when you select a three-layer map, the brownfield quality of life indicator is it remains selected. But here we can be a little bit more specific by selecting demographics, race, and then non-white. And because it's a three-layer map, it allows us to edit the layer in a particular way. One of the things that we can do is make sure that at the census tract level, we can create a threshold where you need at least 75% of persons in that particular census tract are non-white. And right away, students can see how brownfields are concentrated in areas of, where people are racial and ethnic minorities. It couldn't be clearer. Right away you see that. You can juxtapose this too by selecting another demographic layer using race and then white, and then have PolicyMap show you areas with at least 75% persons white, and right away, again, it becomes very clear how environmental racism might be a useful tool for examining deindustrialization in concentrated racial and ethnic minorities, along with a legacy of industrial pollution. And so this is a really interesting way to start a conversation about processes of inequality, particularly in terms of being exposed to environmental burdens. And one thing I'd like to do very quickly is to show you something related to this idea. Not only is exposure to environmental burdens important, but what's also really important is to think about how brownfields are being cleaned up. A big initiative in environmental sociology and environmental work in general is the revitalization of these spaces in order to make them economically viable, residentially viable, and so forth. And so brownfields are actually an interesting conversation to have about essentially what's motivating their cleanup. Is it economic interests? Does brownfield cleanup contribute to gentrification? These are all important issues. And you can actually begin to look at these in the context of PolicyMap pretty easily. So from the 3-layer map, if you select race, non-white, at least 75%. But then change it to block group level, not census tract. An interesting picture starts to be revealed in South Wilmington. South Wilmington, Delaware, again, is made up of a residential area here called Southbridge of largely racial and ethnic minorities. To its west, these brownfield areas are beginning to be redeveloped into more expensive housing, more expensive condominiums, more expensive leisure and restaurant activities, all along what's called the riverfront, which is historically an industrial space that didn't have much residential use. So what's interesting is we can see that brownfields are beginning to be revitalized in a way that can actually contribute to some degree of racial displacement. Again, what we're looking at here is at least 75% of persons at the block group level are non-white, which tells us that the western part of South Wilmington does not meet that particular criteria. This can actually be made a little bit more clearer to students by selecting demographics, race, and then white at the block group level, at least 25%. And this shows you, for example, that areas that do not meet this particular criteria, where at least 25% of the persons are white, are areas that are having brownfield revitalization efforts done differently. This area in South Wilmington, for example, has seen a lot of redevelopment and activity in the past 10 years with restaurants, condominiums, and so forth, whereas the farther eastern side of South Wilmington has not. And so it's a lens on essentially thinking about how race can drive not only historical processes of being exposed to environmental burdens, but also how environmental burdens and their revitalization can also be driven by racial and economic and political interests. One way to sort of embolden this idea is if you put this map in your mind. What I'll do is I'm going to go back to a single layer map to finish here. And one of the things that you can do is you can keep your brownfields data points, and then we can come to housing and median home value. And you can see how on the west part of South Wilmington, the median home value is 191,000 to about 315, whereas immediately adjacent to it, It's between 90,000 and 134,000. And it also shows you how exposure to environmental burdens and their revitalization contributes to home values, which can be some evidence of what we might call green gentrification. So hopefully this area, all the people there will benefit equitably from the redevelopment efforts. The PolicyMap allows us to see a lot of different processes involved in this issue. So I'll finish with my final slide. And students learn using PolicyMap how social processes are located in a place or a space. Historical processes lead to present environmental injustice conditions. We've seen that. We've also seen how cleanup policy and incentives can recreate social inequalities through displacement, perhaps. Students learn how to examine local areas to test hypotheses of environmental injustice utilizing ideas such as environmental racism. And lastly, how to draw critically how to draw conclusions about sociological concepts and how to utilize them and expand their use and utility. So thanks very much for allowing me to share some of the things I do in the classroom.
Wow, well, thank you very much for that interactive presentation, Dr. Perez. Those were some really great examples that you went through there. Just as a reminder, just wanted to remind folks on the webinar that if you have any questions as the presenters are going through their slides, you can type those into the GoToWebinar control panel, and we will address those during the Q&A session at the end. So our next presenter is Dr. Ann Hewitt. Since joining Seton Hall University in 2000, Dr. Hewitt has taught many diverse courses in both the Masters in Healthcare Administration and Masters in Public Administration programs, including Strategic Planning, Health Management, Health Policy, Community Health, Emergency Preparedness, and Global Health and Program Evaluation. She also serves as faculty for the Masters in Healthcare Administration Internship and Practicum courses. Dr. Hewitt's current research interests focus on community health planning, health policy at the state level, the social causes of health disparities, and integrating new e-learning technologies into graduate education. In 2005, she founded the Seton Center for Community Health to serve as a resource to the local community. Dr. Hewitt holds degrees from Otterbein University, Immaculata University, and Temple University. So at this point, I will now turn it over to Dr. Ann Hewitt.
Well, thank you so much, Brian. It's a pleasure for me to be here, and it was an extreme pleasure to listen to Dr. Perez's presentation. I thoroughly enjoyed it. I'd like to take you on a journey, and my topic today there we go. My topic today is focusing on population health management and a PolicyMap project that was completed. I know it was listed as public health, but don't panic because we're covering many of the topics that will work for public health as well as population health. A little bit about my program so it will help you understand why we selected PolicyMap. I have an MHA program both online and on campus, 42 required credits across 15 courses and approximately 142 students. So the curriculum is identical, and any technology that we choose to implement in our program must work for our online students as well as our on-campus students. To aid us in the selection of any type of technology, we developed about 15 years ago a technology infusion plan. And we do this to not only help ourselves select the best technology, but to help ourselves also plan what we're going to introduce to our students so that our faculty doesn't get overwhelmed and neither do our students. So we go through the steps. The first step is any new technology must meet our criteria assumptions. That is, it's appropriate for both formats. We have a selection checklist that I'll introduce to you in just a minute. We always take consideration the timeline. How long will it take us to bring not only the faculty up to speed on the technology, but the students? How are we going to integrate it? Are we going to use faculty champions who pilot it, or are we going to roll it out to all the faculty at one time? And then finally, what are the outcomes of this integration and technology? How important is it overall to what we're trying to do and our competencies in the program? This slide is a visual of our technology selection checklist. So when we talked as a faculty group about the use of PolicyMap and it was introduced to us, we went through each of these steps in detail. How easy would it be to teach the faculty? I have a good core of faculty on staff, but I also use adjunct faculties. So it had to be ease of use, convenient for them. It had to be, of course, ease of use for students, or they're not going to do the assignment that's related to it. Did it help them achieve a higher level of a particular competency? And that was very important, and one of the things we felt that PolicyMap, why it would be beneficial. Next, was it going to integrate into our current platforms, because we do have a totally online format? Were there available tutorials so that the faculty could spend time on designing and integrating the PolicyMap assignment and not so much on the operations? And then finally, could we build in an assessment of how our particular project worked? And then could we build a report based on that assessment? So PolicyMap, all of those criteria, PolicyMap, and we was selected to begin in fall 2016. And I was one of the pilot faculty to develop a project specifically. The project was vulnerable populations, and we used the population health map to help us determine population risks. So I was encouraging students to develop an expertise in defining populations at risk, understanding how you break them out, risk segmentation by characteristics, and then how you do risk stratifications so that you can match the appropriate strategy with the population. I'm very fortunate that I had not only a library liaison, Lisa, I have a library liaison assigned to my MHA program, Beth Bloom, and I have an instructional designer, Riyadh Twal. And you'll see one of my components when we integrate this program was to make sure all the support people were in place before we actually began the project. So in fall of 2016, we introduced the PolicyMap assignment to 2 courses. It was in the Community and Population Health Management class, and we had 2 classes. Online, I had 28 students, and on campus, I had 28 students. We always try to integrate pedagogy over technology, and I think in using PolicyMap, that would be one of the key takeaways I would share, that my students clearly understood their populations at risk, and then they were able to approach PolicyMap in understanding which one of these options they were going to focus on. Now, of course, they're familiar with all the health metrics and indicators, so they wanted to go immediately and try and do all their research in the health option. But in realistic terms, the demographics, the housing, the income spending, education, quality of life was going to help them understand the social determinants that would then help improve their risk segmentation as the outcome. So the group project, they had to create in a previous assignment a PowerPoint presentation on a selected group, and it was a vulnerable group that they chose. So I had 7 groups, and each group in the class had a different vulnerable population. They were to create a presentation that focused on a very vulnerable subpopulation group. So before walking into the PolicyMap assignment, they were very knowledgeable about that population. And that helped them, I think, to narrow down and immediately get into the use of the PolicyMap as a tool to help them develop their risk segmentation. Another point that I did in this assignment was to say, yes, it's a group assignment, but also to require each single student within the group must create their own policy map. So that for every group, I had 4 to 5 policy maps, and they had to synthesize the data and talk about the social determinant and the health status impact factor. So the synthesis at the graduate level was a key component for them, but we had complete student engagement because each student selected their own map, and then the group as a whole got to evaluate and present that information. And I just want to show you a few brief examples of the policy maps and how they were able to tailor them and get more sophisticated in their stratification. This particular group was working on mental health. They started off by examining the percent of adults ever diagnosed with depression. Then they looked at a particular subpopulation, 18 to 34, and they looked at the average cost per meal, which you may think is an unusual choice, but we often know that many of the individuals suffering from mental health problems are homeless as well. So we were looking to find particular areas rather than just targeting certain areas within a city that would help them then narrow it down. In focusing on the risk stratification, we then went to, okay, let's look for areas that have depression greater than 13% of adults in a particular area. We kept the age range as 18 to 34, but this time they looked at college attainment, and in this time they looked under 25%. As we know, there are many young adults who are committing suicide. So even though we have some that are homeless, we also have another group that may be educated that are at risk for mental health behaviors, unhealthy mental health behaviors. We took this one step further, and we cap our depression level, we cap our age, but this time they looked at the poverty. And as you can see, we just continued to narrow and narrow and narrow it down so that we really got much more of a neighborhood look to identify where are our at-risk vulnerable population located. And then, of course, our next step from the designing a plan is to examine if there are facilities located or clinics available to these particular individuals. Now, the next slide looks at illicit drug vulnerability in a particular county, in Essex County. And I'm just bringing this to your attention because they did follow the 3-layer map, the idea of defining the age in this case, which is extremely important risk factor, looking at those that had graduated high school and linking it to depression. But they also went on in this particular slide to incorporate the education, the depression, and the health status. So we can see in this that we're beginning to add in some other indicators. We also have included drug and alcohol treatment facilities and mental health treatment facilities. And if you look over on the right-hand side of the map, you can see where there seems to be an extreme amount of facilities located, but that's in New York City. That is not located over here in our particular county, Essex County, although we have a high number, a particular vulnerable population over here. So for my students, that's a clear mismatch. You would not be able to pick that up and just maybe looking at county data, but it's something that we know in our state, we may not be located, those facilities, where they need to be. This one is quite a busy map. I think they liked all those data points in there, but they did a good job in their synthesis. Again, we're looking at the depression. Our data points have substance abuse facilities that treat opioid addiction. And this time we also focused on drug-related arrests, treatment admissions, and opioid substance abuse. So it's a combination here of social determinants. We're looking at lifestyle behaviors, we're looking at treatment facilities, we're also looking at substance abuse, and we're talking about the criminal justice element that can be combined. I think what's interesting is that you can see how they follow patterns where they're grouped together and where there seem to be a lot of places without a need or a facility. So it's really interesting, and quite a lot of analysis can go into this at a deeper level. This was one of the first times we remember we had introduced it and looked at what the students were focusing on. I have two more slides. This one looks at nicotine use again. And this was a simple slide. Again, the number of people with high school diplomas, back to the education, the percent of all men between a particular age, and the number of adults reported to have ever smoked cigarettes. So it was a little more simplistic, but was just another area where they could see PolicyMap was useful in making their diagnosis. Now, the Zika one was very interesting, and as Zika is relatively new, it's difficult to find enough of the metrics on the healthcare side to track it, but we do know that a large concentration of Zika is occurring in uninsured females. We know that we need to be looking at some of the metrics related to that, which is, are the women seeking health care, prenatal care, and are they receiving any kind of information once they have been screened for a potential risk for Zika. So the conclusion from this group was these areas are prime locations for deploying Zika education and providing public health resources. And we always, as I said, look at our outcomes from any new technology intervention. This was just one of the questions that we asked. I had other very specific questions, but this was looking at, were you satisfied with PolicyMap? And as you can see, for both classes, 75% of both classes were satisfied or very satisfied with PolicyMap. Both online and on campus, relatively no difference between it. We had a couple people that were thinking about it, and a couple people who struggled getting it to work, which you always tend to have anyway. But first time around, we were really pleased with the student feedback on did they enjoy the PolicyMap tool. The open comments, I went through and selected just 2 examples of positive ones and 2 examples of maybe less than positive. Really cool software. Once I figured out how to use it, I discovered my hometown in rural New Jersey had 30 murders per 1,001.9 square miles. So the things that resonate with students are important. Using data loader was helpful. Tables and charts made the information easy. Maybe a simple PolicyMap part of the discussion board could be done as it was foreign to me, and I will definitely implement this, put it in a discussion board for them so they can ask their questions real time right then. And then they wanted me to dedicate an entire class to learning the fundamentals of how to do this, and of course I didn't have an entire class to devote to this, but it's now been rolled out into additional classes, so I think that we have seen that we can implement this without taking one complete class time at the graduate level. My lessons learned, as you can see, is that the content was key to the success. I was fortunate to have an MHA librarian as well as a special assigned librarian for PolicyMap to help me and my instructional designer, so you can never have too much technological support. The guided practice that I did with them in class and that our experts showed them enhanced the deliverables for a first-time assignment across both groups, and that it supported what we were trying to do, that they used the innovation. It wasn't just do this, do that. We were at the graduate level. I wanted to see where their ideas were going to take them, and that we did notice the limited and house status outcomes. And I think that's only there because of the Zika. We were trying to get something very current, and it takes time for that data to be rolled up from the CDC and available for others. So what we've done is we've added it to 2 additional classes. I do have a manuscript in progress, and I hope to provide this as a to our nonprofit community, which we invite for free seminars as part of a center that I have here on campus, because I feel that nonprofit organizations would benefit from this just as much when they do their strategic planning as my students did.
That was great. Thank you, Dr. Hewitt, for the informative presentation. I think we're excited to hear about how you're using PolicyMap in some of those additional courses and with the Student Center. So I think both of our panelists really provided different perspectives on incorporating PolicyMap into their courses and working on PolicyMap with their students, which I think is really great. At this point, we are going to start the question and answer portion of the webinar. We have just about 20 minutes, which is perfect. We have actually had a number of questions submitted through the control panel. So one of them was submitted for Dr. Perez from Vanessa. She asks, Dr. Perez, have you worked with the state or local health departments at all? I think this kind of brief presentation on what's going on in the area would be so helpful to them.
I can just answer by talking? I don't need to type it or anything? Yeah. Okay. I have worked a significant amount, well, I've say interacted with and am privy to the work, and they are privy of my work. Several of the state officials who work for the Department of Natural Resources and Environmental Control. I've not worked directly with anyone in the Department of Health and Human Services regarding this particular issue, but I have interacted significantly with some of the key personnel in the Department of Natural Resources and Environmental Control, as well as the city of Wilmington. And the area of South Wilmington is very well known to both academic researchers as well as the state and the city of Wilmington. And it's been really, so many different things are going on in that area. It's been a very difficult, say 10, 20 years in assessing brownfields and determining how to clean them up. For example, the state of Delaware has a brownfields revitalization program that gives incentives to businesses who are willing to title the property and then have it cleaned up and then start a business on it. But what's really challenging is that even though there are some incentives and programs to facilitate that, oftentimes brownfield revitalization is market driven. And in a residential area that's poor and has concentrated racial and ethnic minorities, it's very difficult to get brownfield revitalization and cleanup done quickly, but also for different reasons than those that are market and economic driven. So in my opinion, the folks in the state and the city, they're well aware of these issues. And my research, I've done survey research and focus groups in the community about how they perceive these issues. And they are concerned about the environment as well, the quality of life and so forth. And I think that where we're at right now is really a discussion of how revitalization is taking shape and how to most equitably see the future of brownfield cleanup and use so that it benefits the people who have bore the burden in terms of quality of life, health, home value, and so forth for the longest time, as opposed to being displaced by what we might call green gentrification. So you know, we're all very aware of it, and I'm hoping that we all can work towards a similar vision. Thanks for the question.
Yeah, that was a very good question. Thank you, Vanessa. So we did one question that we received for Dr. Hewitt is from Maggie, and the question is, how did the students pick their topics for the PolicyMap project?
Oh, that's a relatively easy question to answer, and one that goes back to the idea of the pedagogy before the technology. One of the textbooks that my students use is a community health textbook, and they identify 8 at-risk populations. There are chapters for 8 at-risk populations. After the groups were determined, they talked among themselves about which one of those they would particularly like, and then we kind of talked as a class and we divvied them up. However, there were groups that wanted to focus not after they did a particular population, say maternal and child, to go into and focus on the disease Zika. And then once they had done the overall overview, that first pre-assignment before the policy map, then they were permitted to target a disease such as Zika.
Okay, great, thank you very much. A question that we received from Juan that can go out to both of the speakers. How are you planning to use this data in policy change at the city, county, or state level? Any use in health impact assessments or any feedback that you may have received from policymakers?
I'm sorry. Can you repeat that? It was a little...
Sure. So the question was, how are you planning to use this data in policy change at the city, county, or state level? Have you, I guess, used any of this, data or some of the work that you talked about in health impact assessments? Have you received any feedback from policymakers that you may have interacted with?
I personally have used this information to mostly discuss these issues with the community of Southbridge in civic association meetings and other similar sorts of formats. To me, one of the foremost issues is being able to blur the boundaries between being an academic and being someone engaged in the community. And so I've shared most of my research with, I've published it as well, but I've shared most of my research with the community members, and in trying to make sure that folks are interested and involved in environmental cleanup issues, because poor communities, they generally have other things that are more important to them. Flooding is very important to them, as it's a low-lying area surrounded by wetlands, and they have a variety of other concerns, but trying to convince people, for example, that they should be worried about long-term climate change because of sea level rise predictions in the area, which may interact with existing soil legacy contamination, that's not easy to do. So I have communicated my findings and worked with people in the state really along the lines of discussion to try and formulate plans. For example, I'm really keenly interested in how and if current revitalization and brownfield cleanup efforts take into account the fact that sea level rise, based on conservative estimates, will flood that entire area of South Wilmington in 100 years. So I'm wondering what's driving these sorts of efforts, and if concern for long-term climate change impacts are being thought of, and the use of geospatial maps, layering sea level rise prediction maps with brownfield sites, and discussing things like contaminant mobility and all of that. People are aware of it, but the way that economic policies work, the way that public policies work, may not always take into account both short and long-term impacts. So it has been a challenge.
And I can also share that I see several different avenues for this data to be useful. The first would be, as I mentioned before, sharing it with nonprofit organizations that then can use it to help them tailor their strategies to the programs that they deliver. That's not quite at the formal level of a health impact assessment, which would be more at the municipal level, but that would be one step. Another step where I can see the policy map being extremely useful is the community health needs assessment that every hospital is required to do every 3 years, looking at meeting the needs of the population and determining where those populations are, who are the vulnerable populations, who are at risk. So those are some of my to-do goals and applications as we continue to use this data. The first, I do believe, we'll be sharing it academically, because then once you have that out, you can develop your platforms to share across broader groups.
Great. Thank you both very much. A question we received from Glenn kind of has to do with using some of the data that students can access in PolicyMap, but then kind of taking it out of PolicyMap and kind of doing some additional analysis outside the tool. And so the question is, have you or your students downloaded data from the census tract or block group levels to estimate correlative relationships? And that can be for really either presenter, if either of you have kind of had any experience doing that with either your students or yourself.
I have not taken that step yet. It clearly is a viable step to be integrated in our research methods class, which follows after my particular class that the students have. It would be an excellent step to integrate it across there. We just have not had the chance to do it yet, since our pilot was in fall 2016.
Okay, and so on a kind of similar question related to some of the features in PolicyMap, we've received a couple of questions, one from Yvonne, I think one also from Doug. Their questions related to adding data into PolicyMap, and so you know, adding data from maybe outside sources or from that might not currently be available in PolicyMap, and kind of laying that over some of the data that is available in the platform. So I'll quickly just kind of provide the brief overview as far as kind of the capability for that kind of thing in PolicyMap. There is a data loader tool which allows students or faculty to upload point level data that then can be viewed alongside some of the data layers and other point data that's in the PolicyMap tool. So that's kind of what is what's available through the tool. At the moment, there's we don't have the ability for users to upload layer data, so kind of like thematic data, and so but there is this ability to load point level data. So the question, I guess, for Dr. Perez and Dr. Hewitt is that something, the data loader tool through PolicyMap, is that something that either you of your student or your students have taken advantage of in any of the coursework that you've done using PolicyMap?
I have not done that yet, but it's something. It's really, that's the next step for me. Because there are so many amazing indicators, social indicators, that allow us to examine the social processes that interact with environmental issues, that I really want to encourage, both on my level and also on the level of PolicyMap folks, trying to integrate more and more of these direct environmental indicators. So for example, there's some data on Superfunds as well. There's some data on heat and cool temperatures. There's some data on, I believe, floodplain. But in terms of sort of the ability to examine disproportionate exposure to environmental hazards, one of the key criteria that's missing are data points on proximity to currently polluting industries. So, for example, The EPA utilizes a thing called EJ Screen and some other online databases where I think it might be really cool to try and download data like that and then incorporate it into PolicyMap and get the best of both worlds, where you could, for example, utilize what's called toxic release inventory data, where there might be a toxic site and it talks about what it releases and at what radius are people impacted and so forth. That would be super cool. The other thing that I think would be really useful is concerning existing contamination like brownfields and superfunds, for example, is to try and collate data from local and state databases. The state of Delaware, for example, this exists in the Department of Natural Resources and Environmental Control's website. They list all of their brownfields, both that have been cleaned up, are currently active, and ones that are being assessed. And if you look at that map of South Wilmington, for example, compared to the one that's available in PolicyMap, and remember, PolicyMap utilizes data points from the EPA only, there's probably three to four times as many brownfields. And so the data points are really the next step for me, and I think that if we could really enhance environmental research in PolicyMap by beginning to include some of the things like toxic release inventories and state and local data. But I'd really like to take it to that level. Have not done it yet, though.
I think with the introduction of any new technology, there's always one student that absolutely falls in love with technology and takes the extra step. I did have one student who did on their own, created a special map and did download some data using the data loader, and there was a comment from that student that they thought it was very easy to use. But that might help me highlight the idea of the peer-to-peer sharing that goes on, and the peer-to-peer teaching is even having one student who took it upon himself. It wasn't part of the requirement. It's clearly a next step for me if a student could do it that easy. But it is a next step, and it does again highlight that peer-to-peer learning. When it's an easy technology such as this, it just adds to the complexity and the sophistication of the student learning outcomes.
Great, great.
That's a great point.
That's good to hear. So we are coming to the end of our hour, so we are going to want to kind of start the wrap up. I do want to thank everybody who submitted questions. There were some really great questions there. For any questions that we weren't able to get to during the actual webinar, a lot of these are questions that that us at PolicyMap can respond to directly, just kind of questions related to the tool itself, or if there's any questions that we didn't get to pass along to the panelists, that were kind of directed towards them, we'll send those along to the panelists and then circulate any responses after after we conclude the webinar. So just to conclude, again, I want to thank both of our presenters. I think it's really been an interesting conversation, and hopefully it's been one that's been very valuable to everyone in the audience. A reminder, this webinar will be available online on our Mapchats webinars page. We'll also send out the video link and presentation slides to all the attendees. When we send those out, please feel free to respond to us with any suggestions for other Mapchat topics you would like us to cover or that you would like to see, or just any kind of improvements you might have as far as things that we might be able to do to improve the webinar series. Check back on our Mapchats webpage, which we have the URL up there for details on upcoming webinars. Also check out our blog for insights into data and mapping. And finally, I just wanted to reiterate that in addition to these webinars, PolicyMap offers quick and easy mapping and data visualization tools, both for free and at various subscription levels. We also offer site licenses to universities across the United States with customized access to many of the indicators you've seen today. So if you have not done so, I encourage you to sign up for a trial through our website, so you can explore how PolicyMap can help you or your university use data to inform research and make smart decisions. So thank you again, everyone, for joining us. And if you do have any questions, feel free to get in touch. And everybody have a great rest of your afternoon.
Thanks very much. This was great.
Thank you.